So Marlena, Carly, and I chose the loss of a child to DCF, and how that's an example of unrecognized grief. And we're also going to touch upon the racial disproportionality of the child welfare system.
So I would like to start with introduction to our topic. It's unrecognized grief after losing of a child. Losing of custody of a child to child protection services is associated with significantly worse maternal mental health than experiencing the death of a child. Greater acknowledgement and supportive services should be provided to mothers experiencing the loss of a child through the involvement of child protection services. This is often experienced as a living death, characterized by ambiguous loss, as parents no longer have a control over how and when they can interact with their children, and parents may go for a long period without being able to see their children. The stress experienced by mothers losing custody of their children is often overlooked because they have failed society's ideal of good parenting. When a child is placed in foster care, most of the resources are focused on the child, with little to no support for the mothers who are left behind. Maternal mental health after custody of a child. There are some statistics into this topic. Mothers whose children were taken into care have much higher rates of mental illness diagnosis and mental treatment use than mothers whose children were not taken and mothers who experienced death of a child. Compared with mothers whose children died, there was 25 additional depression diagnoses, 36 additional anxiety diagnoses, 24 additional substance use diagnoses, and 83 additional physician visits for mental illness, and also 405 additional psychiatric per 100 person years among mothers having children taken into care. Mothers who have a child placed in care have much higher rate of suicidal attempts too, and completion than biological sisters and mothers who receive services, even when adjusting for many risk factors. Mothers whose children were taken into care and had 286 additional suicidal attempts and 7 suicidal completions per 100,000 per person years, compared with the sisters who died not have a child taken into a care, which this is just proves that it's a high risk when you losing a child to custody. When you lose a child of the custody.
So when a mother loses a child to the child welfare system, it's normal for her to go through feelings of grief just as if she had lost a child to death. Some feelings that she might have are sadness for the loss of child's presence and the relationship in her life. Anger, this anger could be directed towards their partner, the social worker, the court, or even themselves. They might have some guilt and regret over their past behaviors if they're recognizing their responsibility in the event. They might have some sorrow of not knowing their child or being known by their child, and for mothers that lose their babies. They might feel worthlessness with the loss of their parental role and responsibility, or they might even have relief that the child is being cared for and thriving. Some factors that complicate grieving a child lost to the child welfare system are the fact that the mother experiences disenfranchised grief. There's a stigma attached to losing your child in this way, and they might be blamed, and that blame reduces the public sympathy that they receive. They also, even if they don't actually receive the blame, they have a fear of being condemned or denounced for losing their child. There's also difficulty defining or maintaining their identity as a parent. There's an uncertain resolution. They might get their child back, they might not. So in the legal system, it's uncertain. They may or may not have contact with the child, and they're continuously appearing in court. So there's really that uncertainty that it's hard to define their relationship and their role as a parent still. And the role of the child welfare system first is to secure the child's well-being. And so sometimes the support for parent can lack. So the spotlight is on them during court proceedings. And then once they lose their child, they can feel like they're abandoned and not getting any help. And also, outside of the grief, it could be compounded with problems of why the child was removed in the first place that they're still dealing with. This could be a death of a partner, substance abuse, mental illness, violence, or poverty. So they're trying to change all these things in their life and work on themselves, but they're doing it all while grieving. Ways to manage this type of grief. There's not one surefire way because there's great diversity in how the parents manage the loss. But the ability to manage grief is determined by how they view their role as the parent. If they can still view themselves as a parent, studies show that pain and anger were less intrusive in their lives. And if they recognize their responsibility and why the child was taken away, they seem to cope more easily. How social workers can help in this process for the parents is to still respect them as parents, recognize that this is a true loss, just like grieving a child to death, and also make sure they can receive as much information about the child as possible and involve them where they can, just continuously give them updates so they still feel like they're part of that parent role. And make sure to consider their behavior in terms of their grief, because if they're showing any aggression or drug use, it could be a sign of despair, not confirmation that they could not be competent parents. And make sure to continue to check in with them because they're probably feeling stripped of their identity, and they're getting a lack of sympathy or empathy.
It's also important to look at the racial disparities within the child welfare system. So this grief is affecting more mothers, more Black mothers and other minority mothers, because research does reveal that there's an overrepresentation of certain racial and ethnic populations within the child welfare system when it's compared with the population's representation in the general population. So Black children are represented in foster care at 1.8 times the rate in the general population. And research indicates as well that caseworkers have different risk thresholds. So the way they're assessing the family, depending on a family's race. So with non-Hispanic white families being the less likely to have their case assigned for investigation, be substantiated at investigation. So meaning they open the case and find the investigation to be worthy of opening, or to, as well as to have the child removed from the home. And there is also a problem in feeling represented amongst social workers, because while double the number of children in out-of-home care are Black, twice the number of caseworkers are white. So only 52.28% of Blacks had the caseworker the same race as them, compared to 70.4% of whites. And also when placed in non-kinship out-of-home care, so a typical foster home, Black children are unlikely to be placed with a family with the same racial background due to the disproportional high rate of representation in the system and a general difficulty recruiting foster parents. But this can greatly affect the child's sense of identity and ties to their culture, so that's an important consideration. And this is a chart depicting the US child population compared to the out-of-home care child population. So you can see that while non-Hispanic Black children make up less than 14% of the US child population, they actually make up 24% of children in out-of-home care. Hispanic children of any race make up 24% of the US population, but 22% of children in out-of-home care. White children make up 52% of the US child population, but only 43% of children in out-of-home care identify as white. So you can see the disparities and how they kind of manifest themselves. So what this means for practice is that it's definitely something that we need to keep in mind as we're practicing, because child welfare case workers often serve families and children with a different ethnic, racial, and cultural background than their own. And relationships are heavily influenced by culture as well as the way that we perceive them. So it can lead to cultural misunderstandings and bias, even when unintentional, due to systematic partiality, which is defined as allowing one's membership in a group to give preference to that group over others. So kind of the in-group, out-group, where you're even unknowingly looking at your group and perceiving it in a more positive way. Assessments of parent-child relationships may be biased due to these cultural differences. The racial differences may also influence how much the client is willing to disclose, which again may negatively influence the social worker's perspective because they may interpret it as hesitance when it's really just a mistrust from trauma. So another factor is the influence of complex trauma and poverty. So Black children may be disproportionately represented in out-of-home care statistics because of this high exposure to complex trauma, which is chronic exposure to multiple instances of trauma in various contexts. So kind of anything on like the ACE survey, including dangerous neighborhoods and things like that. And complex trauma can interfere with attachments and negatively affect relations due to emotional and regulatory difficulties. So in addition to experiences of racism, which is a trauma in itself, the large wealth gap between Blacks and whites is responsible for an increased exposure of Blacks to complex trauma, because low social economic status increases the risk factors for child maltreatment. And it also, poverty increases exposure to social services and mandated reporters, which is known as exposure or visibility bias, because they're being seen more, they're more likely to be reported on if something is going on, just because they are so much more visible. As well, Black communities tend to have less access to and availability of services necessary to meet treatment plan objectives. So it's kind of putting roadblocks in the way of parent-child reunification, because these services and these tasks that we're asking people to get done are almost impossible to do due to lack of availability or accessibility. So social work is definitely not exempt from racism, and it's important that, you know, we consider different strategies to be implemented to really help reduce the racial disparities. One important aspect is training around attachment, with an emphasis on how attachment appears across cultures and amongst different races. It's important to also improve training on enhancing self-awareness and insight to really kind of help work towards catching those unintentional biases. Again, racial and culture sensitivity training. Another important thing is an increase in preventative services in Black communities with greater focus on supporting mothers, especially those with their own trauma history, identifying those mothers and putting in preventative services such as affordable childcare, therapy, parenting classes, housing assistance. Supporting the family allows the mother to have the supports needed to better care for her child. So of course, the focus needs to continue to be on protecting children, but the care for mothers definitely needs to be considered. Another important factor is to accurately assess the client's ability to meet the treatment plan's objectives. And if for whatever reason these aren't available, there needs to be support provided to offer alternatives or whatever is the barrier to getting those services done to kind of work through those. Creative solutions are also important too. There was a suggestion of even making communities so that the whole family can be removed from traumatic environments and work and heal together as a family. Increased family involvement in treatment planning, racial sensitivity training for foster parents, which includes encouraging support of foster children's backgrounds. And regular policy renewal for agencies is also very important. People within these agencies need to not just look at national demographics, but also local demographics so they can tailor their policies to the population they are serving. And those are our references.